In today's video, we're going to talk about what are the signs you can use to realize you have cancer, what is the current mortality rate in cancer, which cancers are the worst, and which cancers have the least mortality rates. Let's delve into it. Cancer is one of the leading causes of death worldwide, accounting for nearly 10 million deaths each year. However, there are some types of cancer that are more deadly than others. In this video, we will be discussing the top 3 cancers with the highest mortality rates. We understand that this topic can be sensitive and may cause anxiety or fear. Our intention is not to spread fear or misinformation, but rather to provide you with valuable insights and knowledge about these conditions. If you are concerned about your health or have any pre existing medical conditions, please consult with a qualified healthcare professional. Remember, knowledge is power, and being informed can help you make better decisions for your well being. So let's get started. The most common signs that indicate the presence of cancer include unexplained weight loss, changes in bowel habits or bladder function, unusual vaginal discharge or bleeding, a lump or nodule in the breast or elsewhere, skin changes such as new moles, sores that refuse to heal, or changes in existing moles. Other signs include fatigue, fever, chills, persistent pain, and a history of smoking or exposure to carcinogens like asbestos. While these signs don't necessarily mean you have cancer, it's crucial to seek medical attention if you notice any of them. Early detection and diagnosis can significantly improve the chances of successful treatment for many types of cancer. Cancer is a complex group of diseases characterized by the uncontrolled growth and spread of abnormal cells. It has the potential to affect almost any part of the body and comes in various forms, each with its own set of challenges and prognoses. The most common types of cancer include lung, breast, colorectal, prostate, and skin cancer. Lung cancer is the leading cause of cancer related deaths, accounting for more than 1.35 trillion mortalities annually. Its high mortality rate is attributed to late stage diagnosis and limited treatment options. Breast cancer affects 1 in 8 women worldwide and is the second most common cancer among females. While survival rates have improved, it remains a leading cause of cancer deaths in women. Colorectal cancer, often preventable through lifestyle changes and screening, claims over 692,000 lives each year. Prostate cancer primarily affects men over 50 and is the second most common cancer in males. While most cases are slow growing, aggressive forms can be life threatening. Skin cancer, the most prevalent cancer worldwide, is primarily caused by excessive sun exposure. Although it's often treatable, regular screenings are essential due to its potential to spread. Each of these cancers requires specific treatment approaches and carries its own prognosis. Understanding the unique characteristics of each type is vital for effective management and improving survival rates. Now that we have established what cancer is and the different types of cancer, let's delve into what are the top 3 cancers with the highest mortality rates. Number 1, lung cancer. Lung cancer tops the list with the highest mortality rate among all cancers, claiming approximately 1.35 trillion lives annually. It occurs when abnormal cells in the lungs grow uncontrollably, often linked to smoking or exposure to carcinogens. The primary challenge in treating lung cancer is its late stage diagnosis when it has spread to other parts of the body. Treatment options include surgery, chemotherapy, radiation therapy, and targeted drug therapy, depending on the stage and type of lung cancer. Survival rates vary widely based on the stage at diagnosis, with 5-year survival rates ranging from 5% to 70%. Early detection through regular screenings and quitting smoking are crucial for improving outcomes. Number 2, colorectal cancer. Colorectal cancer originates in the colon or rectum and is the third most common cancer worldwide, claiming over 692,000 lives each year. Unlike lung cancer, colorectal cancer often shows early warning signs such as changes in bowel habits, rectal bleeding, and abdominal pain. Regular screenings, including colonoscopies, can detect and prevent colorectal cancer. Treatment options depend on the cancer stage and may involve surgery, chemotherapy, radiation therapy, and targeted drug therapy. The 5 year survival rate for colorectal cancer is around 64% when diagnosed in its early stages. However, it drops to 15% when the disease has spread to distant organs. Lifestyle factors like diet, physical activity, and obesity play a significant role in its development. Adopting a balanced diet rich in fiber and low in processed foods and red meat can reduce the risk of colorectal cancer. Maintaining a healthy weight and engaging in regular physical activity are also essential for overall gut health and cancer prevention. Number 3, liver cancer. Liver cancer, primarily affecting the liver cells, is the third most common cancer globally, accounting for approximately 830,000 deaths annually. It often develops in individuals with chronic liver conditions like hepatitis B or C, or those who have consumed aflatoxin, a toxic substance produced by certain molds. Symptoms may include abdominal pain, jaundice, and weight loss. Treatment options include surgical removal of the tumor, liver transplantation, and various therapeutic interventions. The 5 year survival rate for liver cancer is around 18%, primarily due to late stage diagnosis. Prevention strategies include avoiding the consumption of aflatoxin contaminated food, practicing safe sex to prevent hepatitis B transmission, and getting vaccinated against hepatitis B. While these are among the deadliest cancers, there are other types with high mortality rates, including stomach, esophageal, pancreatic, and cervical cancers. Each of these diseases poses unique challenges and requires specific treatment approaches. Ongoing research and advancements in medical technology continue to improve our understanding and management of these conditions, offering hope for better treatments and ultimately contributing to a reduction in their mortality rates. On the other hand, let's explore the cancers with the least mortality rates. It is important to note that even cancers with relatively lower mortality rates can still have significant impacts on individuals and their families. The statistics presented here should not be interpreted as an absolute measure of severity, but rather as a way to compare different cancers and understand their potential outcomes. Additionally, advancements in medical research and treatment options are constantly evolving, and it is possible that the mortality rates for these cancers may change over time. Understanding the least deadly types of cancer can provide valuable insights into effective prevention, early detection, and treatment strategies that can be applied across various cancer types. By learning about these cancers, we can gain a better understanding of the factors that contribute to their lower mortality rates and potentially translate these lessons into other areas of oncology. This knowledge can inform public health initiatives, medical research, and personal health choices, ultimately contributing to the fight against cancer as a whole. So, what are the cancers with the lowest mortality rates? Here are three examples with the lowest mortality rates. Number 1, basal cell carcinoma. Basal cell carcinoma, the most common form of skin cancer, arises from the basal cells in the skin's lower layer. It is primarily caused by excessive sun exposure and has a very low mortality rate. Early signs include the development of a pearly or waxy bump, a bleeding or scabbing skin lesion, or a newly formed or growing mole. Treatment options range from surgical removal to topical medications. Because it rarely spreads to other parts of the body, the 5 year survival rate for basal cell carcinoma is nearly 100%. Regular skin screenings and protective measures like sunscreen use are essential for early detection and prevention. Number 2, ductal carcinoma in situ. Ductal carcinoma in situ is a non invasive breast cancer that occurs in the milk ducts. It has not spread to surrounding tissues and has a 99% survival rate when detected early. This form of breast cancer may be identified through mammograms or during breast exams, often presenting as a small hard lump in the breast. Treatment typically involves surgery to remove the affected ductal cells. While ductal carcinoma in situ has a high survival rate, it's essential to address it promptly since it can progress to invasive breast cancer without proper treatment. Regular breast exams and mammograms are crucial for early detection. Number 3, superficial bladder cancer. Superficial bladder cancer affects the lining of the bladder and is one of the less severe forms of cancer. It has a 5-year survival rate of around 95%, primarily due to its limited depth of invasion. This type of cancer may cause changes in urination and blood in the urine. Treatment options include transurethral resection, where the tumor is removed through the urethra, and intravesical therapy, where medication is instilled directly into the bladder. Regular bladder screenings are essential for early detection and management. While superficial bladder cancer has a relatively good prognosis, it is important to monitor it closely as it can recur and in some cases progress to a more aggressive form. While these cancers have lower mortality rates compared to others, it is essential to remember that cancer is a highly complex and individualized disease. The prognosis for any type of cancer can vary depending on numerous factors, including the stage at diagnosis, the patient's overall health, and the effectiveness of treatment. Therefore, while understanding general mortality rates can be helpful, it is crucial to consult with a qualified healthcare professional for personalized guidance and treatment plans. That's all for this video. I hope you found it informative. Please stay tuned for more health related videos. Don't forget to hit the like button and share it with your friends and family. Take care and stay healthy.